Evidence-based medicine is the careful use of the best evidence to make the best decisions about individual patient care. In a practical sense, this means integrating the clinician's expertise with the best available evidence and incorporating patient preference to make sure that patients receive the best treatment for any given situation. It's really important that healthcare professionals track down the best available evidence to inform the management of their patients, and this ensures that the patients really receive the optimal care.
The best treatments for osteoarthritis really involves looking at the holistic management of the disease, and there I mean specifically paying attention to why you developed osteoarthritis in the first place, and paying particular attention to non-pharmacologic, non-medical and non-surgical treatments in the first instance, and that's what most guidelines would advocate for. So I'm there thinking about trying to particularly focus on if you're overweight and obese, losing weight, particularly if you're sedentary or your muscles around your joints are not particularly strong, trying to improve muscular strength, aerobic or cardiovascular fitness as well. And again, if you're depressed and or if you've got significant psychological impairment, either as a consequence of the disease or as a complete separate entity, paying particular attention to the treatment and management of that as well. Following appropriate non-pharmacologic conservative management, weight loss, exercise, using braces, paying attention to psychological needs, then it might be appropriate to use analgesic medication, pain-relieving medication, such as anti-inflammatories, topical ointments, that may help to facilitate the treatment of the disease. If they are also ineffective at managing the symptoms that relate to the disease, then surgery may be an option.
A quality physiotherapy care for arthritis should involve quite a bit of time and dialogue between the physio and the patient, taking quite a good bit of time to get to know you and the problem and how you've managed that condition, and to really work out what it is that you need and want out of managing your problem, because it does differ across different patients. There's no recipe for arthritis. But there are a couple of very key core components that are essential to quality physiotherapy care. These include quite an individualised, tailored exercise program for your condition. So whether it be your hip or your hand or your knee, a structured, somewhat prescribed exercise program that you can undertake on a regular basis, roughly rule of thumb 3 times a week, should incorporate some muscle strengthening exercises, perhaps some flexibility exercises if that's appropriate for you, as well as some aerobic exercise is really critical and an essential component. Alongside that though, it's not just about a structured exercise program that you undertake, a couple of times a week and that's enough, but it's also about general physical activity or incidental activity. So a quality physio program will also involve a bit of a discussion with ways and means that you can increase your general physical activity levels. And that doesn't have to mean that you're going to be going for a run or, walking around the block for 2 hours every day. Often it can be simple strategies that you can be built into your daily activities as well. So a real focus on physical activity. If you're overweight, a discussion around strategies to help you lose weight, or perhaps even discussing options for who you might be referred to who can further help you to minimise and keep your weight down. And the flip side of that, for people who aren't overweight, it's really important that they don't put on weight, because that really does increase the forces and the stress across the joints. And so that's really particularly relevant if you've got hip or knee arthritis. Another sign of good physio is that you won't necessarily require multiple visits in a short time frame, and in fact that's probably not going to be best for you. Self-management and exercise really requires regular visits, but with an interval in between. So it may well be quite appropriate that after your first visit, you don't need to see the physio again for several weeks, or perhaps if the physio thinks, perhaps not for a month or so, but some regular follow-ups to check how you're going and progress your exercise program, because that's also quite important, is that Being given an exercise program on day one is fantastic, but that doesn't mean that that same exercise program will be appropriate for you in 6 months' time. So quality physio should build in a regular follow-up at intervals over the long term to make sure that that activity and exercise program can be tweaked to suit you as your circumstances and your joint conditions change, for example. One other sign of quality physio is largely a hands-off approach to management rather than a physical hands-on approach by the therapist. Certainly for a proportion of patients there will be manual techniques that will be appropriate. That will depend on your assessment. So the physiotherapist may decide some massage or joint mobilisation or taping techniques might be appropriate for you, but that won't necessarily be for everybody. Certainly there's not a lot of research evidence to support the use of many electrotherapy devices that people might be familiar with, such as ultrasound or laser or interferential devices, and so we wouldn't be expecting that should form a large component or really play any major role in quality physiotherapy care for arthritis.